Hello, and welcome to the course. I'm Stephen, your host for today, and I'm speaking with Professor Wei Wei Lee from the School of Medicine. Dr. Lee has a master's in public health from Harvard University, a medical degree from New York Medical College, and is an assistant professor of medicine at UChicago, as well as assistant dean of students and the director of wellness programs. She's also a junior faculty scholar of the Bucksbaum Institute for Clinical Excellence and a fellow of the Academy of Distinguished Medical Educators. She's here to talk to us today about her career path and how she became a University of Chicago professor. Professor, thank you so much for joining us. How are you today?
I'm really well. Thank you for having me today, Stephen.
You're welcome. I'm glad to hear that. We really want to hear your story and how you got to this point. But first, let's hear a little bit about where you are right now. So, could you tell us, please, what your role is at UChicago, and just a little bit about what that actually entails, what that job title actually means?
Of course. So I am a physician. I'm a primary care doctor, and I work here in Chicago at the university's medical center. So we're located here in the south side of Chicago. So I am a clinician, so I see patients in the primary care clinic. But I also work in the medical school as an associate dean in student affairs. So work with our medical students and work on career advising, helping them with their residency applications, and that's the training that students move on to after school as they train to be physicians and work on, mentorship research and work related to that.
Certainly will get more into what you've been up to recently, but for now, I want to go way back to when you were a kid, really, like middle school or high school years. What were you interested in at that point? And, what did you think you would end up doing? And did it bear any resemblance to what you do now?
Yeah, that's a great question. So I am a child of immigrants. And actually, I was born in Taiwan and immigrated to the United States when I was quite young. And I am from a Chinese background. So typical sort of Chinese immigrant parents, they implanted in me quite young that they, really thought it'd be wonderful if I became a doctor or a lawyer. And they seemed to hone in on the doctor piece. So I certainly had that in the back of my mind as I was growing up and thinking about what it would mean to be a physician in my career. But I would say, as I went through middle school and particularly, in college as well, I found that I really enjoyed thinking about a career in perhaps education. So working in teaching in some way, and had started to explore a career in medicine, what it would mean to be a doctor, what kind of doctor I might want to be interested, I would be interested in exploring. And so those interests really come together. And I certainly, was exposed to science when I was growing up. I went to a high school that was focused on science, and that was a really nice background to have to think about future careers as well.
Okay, so it definitely sounds like things were trending in the direction of med school. Could you just lay out for us, though, what your path was, undergrad and then medical school, and I don't know if you did anything between that, but what you did for those years, and then how you found your way to UChicago.
Absolutely. So for college, so I grew up in the New York City area and went to, pretty large New York City public high school. And for college, I wanted a different experience. I chose to go to a small liberal arts college that was outside of Boston at Wellesley, and it was a women's college. And it was such a wonderful experience. It's a small class sizes, really being able to connect with the community there of students and faculty members, having that sort of liberal arts sort of broad perspective was really incredible as well. And so I studied psychobiology, which is a major I think that no longer exists, but it was an equivalent to neuroscience, basically. So you were taking classes both in the psychology department as well as within biology, and it really focused on neuroscience in particular. Throughout college, I did not have a chance to go abroad, and so I knew that I wanted to have some sort of international experience. And what I ended up doing was I did apply when I was a senior in college to medical school, and through the application process, I was admitted to NYU for medical school, and I decided at that point to actually defer my admission for a year and applied also at that time for a fellowship that Wellesley College had for its graduates called the Wellesley Yenching Fellowship. And it was a teaching fellowship. So allowed me to actually work in Hong Kong for a year at Chinese University in Shatin in Hong Kong and do teaching within the neuroscience department there. And then that was actually around the time of 9/11 in the United States. And so, after sort of the fallout and, thinking about New York City in the aftermath of 9/11, that was when I was supposed to head back to medical school.
Mhm.
And I actually decided at that point that I wanted to take an additional year and do some further work in Hong Kong. So I extended my leave for 2 years. So I deferred starting medical school for 2 years and then came back to NYU to do my medical school training. And between my third and fourth year of medical school, I actually took a gap year to do a master's in public health at the Harvard School of Public Health and focus on global health and international health work there. And I went back for residency training at New York Presbyterian Hospital, which is Cornell, so located on the Upper East Side of New York City, and did a primary care residency there, so in internal medicine, focused on primary care. From there, I actually applied to a scholarship when I was in medical school through the government. It was called the National Health Service Corps Scholarship, where they helped pay for medical school. And I committed to working in an underserved community in the United States in a primary care field. And so when I finished residency, that's what brought me to University of Chicago, which is where I am now as a primary care physician.
All right. So, yeah, one thing that I was going to ask a little bit later was about your international experiences and how they may have affected the course of your career or just the way that you approach things. Particularly since this show is brought to you by the Francis and Rose UN campus in Hong Kong, and you were in Hong Kong. I'd be very curious to hear about how do you think that time affected you as a doctor, and just sort of how did it affect your career in general?
Oh, I thought it was an incredibly impactful time. I think for me, as someone who had just graduated from college, to be abroad was, incredibly exciting, but also to be, in an academic environment. And one of my career interests had always been a little bit centered around education as well. So to be able to work in higher education at Chinese University was incredible. And there was, a community of other recent college graduates there through the Yale China program who were also teaching at the university there. So there was a kind of community of like-minded people with similar experiences. And we kind of navigated this post-college, kind of sort of young adult transition together. And it was incredibly exciting to work with the students there, but also to have a chance to be exposed to, different cultures, to be able to travel, to be able to have an income, after college
Yeah.
was lovely. And so, and also gave me a lot of incredible practical, I think, working experience to, it was certainly challenging in some ways to have just graduated from college and then be expected to teach, some neuroscience and neurology related content, right immediately, following graduation. And so it was an incredible kind of growth and learning opportunity there as well.
I also wanted to ask about your master's. What compelled you to maybe change directions slightly and do the master's as you were also working towards becoming a doctor? And again, like how do you think that impacted your career?
Yeah, I do think that actually has a lot of tie-ins with my experiences, working as a teaching fellow at Chinese University. And again, really having had the chance at that point to also explore some community health projects that were going on in China. So through some of my contacts in Hong Kong, I was able to do some volunteer and service work in Yunnan in sort of Southwest China. And I was in the city of Xishuangbanna, and there was a focus and an effort at that point to do a lot of HIV education because that part of China had higher rates of IV drug use and higher prevalence of HIV. And so there were some intensive community-based efforts to address education and public health around HIV. And so I was able to work with a local nonprofit and do a lot of trainings within smaller communities. And there are a lot of ethnic minorities in that part of the country as well. And so being able to really think about how to make some of this health information really accessible was really meaningful. And so I took a lot from that experience and colored a little bit of what I thought I wanted to do in my future. And so, medical school, coming back to the US for medical school, I think in many ways was another big transition and sort of going from, 2 years of working and doing, a lot of service-based work and, more hands-on type of life experiences. Going back to the classroom was a little bit challenging, I would say, just in that, medical school, there's a lot of information to learn in a short period of time. And certainly, usually the way medical school is structured in the United States is that, you have 2 years of preclinical curriculum where it's a lot of classroom learning. And then typically your third and fourth year, when I was going through medical school, would be in the hospital, in the clinics, doing a lot of clinical rotations. And so, it was a really big push to, get through the preclinical years. And then when you are rotating in the hospital and starting to see patients on that end, it's also, a pretty intense schedule depending on what rotation you're doing. So surgery or internal medicine or OBGYN. And so, by the end of third year, I honestly felt really, really tired and burnt out. And I felt like I needed to take a little break to refocus on what I wanted to do in my life and career. And I knew I was going to do primary care already because I had already signed up for that National Health Service Corps scholarship. But I was also becoming increasingly interested in perhaps integrating more public health work. And so I was able to apply, to public health school and, explore more of that concentration on international health and to give myself some time away from the intensity of the medical school curriculum to refocus on some of my goals.
What were those goals? Is that reflected in where you are now? Like, where did you see yourself going at that point?
Yeah, that's a great question. So I would say one of the reasons I was really committed and, interested in a career in primary care is, I mentioned my family is from Taiwan and I was born there. And when we came to the United States, I was probably about 5 years old and my parents were immigrants, obviously. And, in Taiwan, my mom and dad had gone to college and my mom was working in business. My dad was an architect. But when they came to the United States, they really had to restart. And we were undocumented for many years when I was a child. And so, we didn't have access necessarily to routine health care and the idea of primary care as a place where, as a physician, you can really impact people's lives and trajectories and the importance of having primary care, a physician who's there to, help your family and also individuals really think about their health more holistically to navigate, a challenging healthcare system. And, the US healthcare system is incredibly, incredibly tough, to sort of make heads and tails out. And so to be that type of advocate to work with underserved patients was always something that was really important to me. And so, those were some of my initial thoughts about what I wanted to do. And then the global health piece, I think, really helped me put into perspective this idea of working with underserved, but also on a larger scale, so I was fully aware that as a physician, you have the ability to impact many individual lives, with your patients. And for me, also, I sort of knew I wanted to do something in medical education down the road. So to be teaching, on some level. But again, that's sort of more of an individual impact. And what I saw as sort of an interesting draw with public health is that there's sort of the potential to think about, health policy, but also to really be thinking about population health and how, healthcare decisions can impact not just individuals, but entire groups of people. And, as we've all seen through the COVID pandemic, public health has lots of different intersections with how medicine is practiced and, has the ability, to, I think, impact lives in different ways.
Yeah, something that people are probably thinking about much more in the last couple of years than
Yes.
they had before. One thing that I wanted to ask is who were some of the major figures in this story besides yourself? I mean, I know that you said your parents, encouraged you to look in the direction of medicine. Were there other like very important mentors or just, people who were there to support you or give you advice as you sort of charted your path?
Yeah, I think I was very fortunate. I think as a first, generation college student in the US, navigating that system, I don't think, my family had a lot of input on, how to apply to medical school or, how to be a successful candidate. And so I definitely leaned heavily on my advisors and deans in college, and they were incredibly helpful in thinking about ways to do and be really centered and focused on what was important to me around service, around working with underserved communities. So I started working with a clinic in Boston's Chinatown that served Chinese immigrant patients. I started volunteering at Tufts when I was a junior or sophomore in college to, work with the pathology department and do some research there. And so I think there was a lot of encouragement to kind of explore and, try and find mentors who were doing the type of work that was meaningful to me. And I think that was, really, really powerful.
Well, so could you describe a little bit, what you do now? And I'm really curious, like how much, practicing you're doing. Like, are you seeing a lot of patients, or are you mostly doing administrative stuff? Are you still teaching on a regular basis? Like, what do your days look like?
Yeah, that's a great question. So I think academic medicine is really for people who like to do a lot of different types of things in their day to day and in their careers.
Yeah.
And so, I have found that really invigorating and something that helps me, continue to explore different connections and areas of interest. And so what that means for me, though, is that I do still see patients in the clinic. I see patients about, one full day, one and a half full days a week. And one of those clinic sessions, I actually work with our residents who are internal medicine residents in training in the residency program and oversee them in their primary care clinic. I also see patients who are hospitalized. So the way that we have it function is that all of our primary care internal medicine doctors also rotate for 2 weeks at a time to take care of patients who are admitted to the hospital. And so I see hospitalized patients about 1 month a year. And then the rest of my time, it's really divided between my work in the student affairs office, so administrative work with the medical students. I serve as a career advisor to a subgroup of our students here, so navigate them from the time that they start medical school to when they graduate and enter their residency programs in career advising and really thinking about their goals and what their applications and futures might look like in different medical specialties. I also have a chance to direct our student free clinic experiences, which is really meaningful. We have a number of free clinics that our students run for different patient populations in the Chicago area. And I also direct the student well-being program here at our medical school. So that's about another 30-40% of my time. And then the rest of my time is spent on research as well. So when you're in academics, there's an expectation to have an area of research focus. And this, helps you with promotion and with, putting together research questions that are meaningful in your particular area, but also allows you to, do some studies. And for me, my focus is medical education. And so what that means for me on the research front is developing different curricula or educational programs, and then studying the impact on, students or patients, related to that curriculum. So for example, I study a lot of interventions and design a lot of interventions on how technology impacts patient-doctor communication. And so, we've done research studies interviewing our patients about their interactions with their physicians when the doctors are using electronic health records and computers. We've done a lot on telehealth since the pandemic. And I also do research on medical students and burnout and mental health concerns and how we can improve well-being for our students and residents and faculty. So those are sort of the research areas as well.
Okay, so that's quite a bit. um, a lot to juggle. I'm curious, like, what are your sort of favorite and least favorite parts of this job, or I guess really of these jobs? I mean, like, what do you find really rewarding about it? And also, if you can be candid, like, what are some things that if you didn't have to do, you might not want to about this role?
Oh, yeah, no, really good question. So I really value being a primary care doctor because I get to know my patients over a long period of time, and not just my patients, but their families and their loved ones who are involved in their care. It really allows me to understand, how they as an individual define, their health and what's important to them, what values really drive their decisions around healthcare. And that longitudinal relationship is really, really wonderful. I've been here in my role at University of Chicago for about 12 years now. So it's, just been an incredible opportunity over time to really see those relationships develop and deepen. You're walking with someone along that journey of highs and lows in their life as sort of health impacts their experiences. And that's just an incredible privilege. And I really get to, I think, fulfill some of my interest in thinking about working with underserved patients. And I had I still do have an interest in global health, but there's a lot of corollaries between working with underserved patients, in the U.S. here in the South Side of Chicago and resource limited global health settings, right? I think there's so many
Mhm.
parallels in thinking about community engagement and really thinking about, helping patients navigate, access to chronic disease management, like making sure that, we're thinking about disparities in care and how systemic structures really impact that. And I'm really fortunate here at the University of Chicago campus that many of my colleagues are, also really dedicated to thinking about health disparities and health equity and how we can better serve, the community here in our immediate environment in the South Side. And, the other really meaningful part of my job is working with the students. I mean, I just think that the future of medicine is so bright. The medical students are just incredible, blow me away with, fresh eyes on, the system as it is, medical education or our healthcare system. And our students are real advocates for change about how we can make things better and, have really allowed me to think about, how we can better support our students, but also making sure that we're keeping abreast with all the important things that are happening in our world around us, thinking about health equity and social justice and thinking about this coronavirus pandemic and thinking about, so many of the pertinent issues that are of our time and critical to our time. So those individual relationships with students, that mentorship, that advising, and then getting to work with them on, thinking about medical education, where we are now, where we want to go, has been really meaningful.
So, one thing that we're curious about is, are there directions that you can see yourself going in that are maybe different, or maybe build on what you're doing now? I mean, are there other research topics or just areas of interest or other work that you would be interested in doing that you think you might be looking to do down the road?
Yeah. So, I mentioned that I do some work right now on the well-being of physicians and trainees. And so, the literature that's been published, the studies that have been done over the past 10 or 15 years or so, do really show that there's a high rate of burnout amongst physicians and students and residents, and also just, high rates of mental health distress, so depression, anxiety, other concerns. And so I think there's a real momentum in medicine and academic medicine to address those concerns really systematically. So again, my role as the director of well-being for medical students did not exist when I went to medical school,
Mm.
many years ago. But most medical schools, now actually are, taking a focus on the well-being of our students and really thinking about how we can create medical education systems and learning environments that support, the growth and have reasonable expectations for, the workload and other stressors in students' lives. And we're seeing that become more and more prominent in sort of resident education as well as, the lives of faculty and practicing physicians. So I think there's a lot of growth that can happen, and how can we impact the well-being of our community of physicians and learners? Because there's also research that shows that when your doctor is burnt out, the quality of care that patients receive is lower, and there's more medical errors. There's physicians who leave the profession because they are really burnt out and don't feel like they, want to operate in a system that's not supporting them. And so I think that that's impactful. And then, I also think about whether or not there's more opportunities for me to work down the line and thinking about other international health work. That's certainly something that was really, I was really passionate about, throughout my training. And, I have a chance currently, still able to work on international health on a medical education level with a partnership that University of Chicago has with Wuhan University in China. I think we're all aware of Wuhan now. But U of C has had a partnership with the medical school there for about 7 or 10 years now, and we've had the opportunity to do a lot of exchanges and curriculum reform in the Chinese medical, healthcare and education system there, and so that's also been really meaningful as well.
Cool. Well, yeah, my last question is just, for someone who was considering entering your field, and I guess I should really say fields, but someone who's interested in doing any or all of the different types of work that you do in your role, what advice do you think it would be important to share with them?
Yeah. So, I would say that If you're interested in a career in medicine, and specifically in academic medicine, I think part of it is really understanding why you're going into that profession. So for me, that why was really around working with underserved patients, really understanding that primary care was something that was important to me. And you don't need to know exactly what you're going to go into, from day one, but some ideas of what it is that you find fulfilling and meaningful, in the type of work that you envision yourself doing as a physician. Because I think there's many ups and downs in any professional career. And, throughout medical school and residency, there were certainly periods when I felt really burnt out and felt really just exhausted, and being able to kind of reconnect with that why and, letting go of the idea of perfectionism. I think many of us are guilty of holding incredibly high standards for ourselves and just recognizing that, failing and falling short is really part of the journey and path to any career, but certainly in medicine, being able to, have that perspective for yourself and that you're there to learn and grow and to find the support and mentorship and advising that you need in, the faculty you'll be working with and your advisors, and also find that community of friends and peers who will support you along the way. I think that's all incredibly important.
All right. Well, that's, I think, a lovely note to end on. So, Professor, thank you so much for coming and, taking me through this story and explaining a little bit about what you do. It's been a pleasure.
Thank you so much. It's been a pleasure.
Thank you, Professor Lee, for your time today. And course takers, if you enjoyed listening to today's interviews, please check out the others. You can find out more about the University of Chicago through uchicago.edu or the university's campus in Hong Kong through uchicago.hk. See you around.